Good morning, everyone. Happy July 27th, right? Welcome to our broadcast. Those of you that are here, thank you for attending in person. And those of you that are in the comfort of your own home, braving the humidity levels. It was a beautiful weekend. You can definitely feel the humidity today. Thank you for tuning in. And if you are one that is watching this broadcast throughout the week, if anyone has any questions related to the content, please feel free to come down to the administration suite, see Ashley and or any of the presenters that are here today at their respective offices or phone numbers, and we'll be glad to review any questions that you have. First, just want to share some good news. Adam's been here, Adam down in the Wellness Center. He's been here for a little while, and he says he's never seen this in his entire time he's been here. Never. On week 10 of the bocce tournament, so we're at week 10. Saturday was week 10, and he's never seen this before. We currently have a 3-way tie for first place. 7 wins, 2 losses for a total, or matches, I'm sorry. So we have the Woodlands, Saratoga, and Ascot that are that are tied for first place. And just as a side note, when we started this bocce tournament, I think I shared with everyone where the trophy is sitting right now. It's in the lobby of the Ascot building. And so, I don't know, here come all the Ascot folks now. Anyway, Adam had said he has never seen a 3-way tie or even a tie at this point. There's always a clear leader. So congratulations to Woodlands, Saratoga, and Ascot, and Dancing and Aladar are not far behind either. So anyway, good time had by all. It's a great summer tradition at Whitehorse Village. So glad we have 2 bocce courts out there. And we made those improvements over the last couple of years. That was thanks to Adam wanting to enhance that whole area so that folks had some shade, more places to sit down, because we know that bocce over a period of time really caters to about almost 200 people. When you think about all the teams, the spectators coming out. So it's a great, like I said, summer tradition. Okay, we probably have about a 25-minute broadcast today. A lot of little updates. First update is from Jeff. Jeff has, I think, 3 things to talk about. Morning, sir.
Good morning, Michael. Good morning, residents. Thank you for having me. So the first update I wanted to give was based off of some residents asking about the jets in the pool, the hot tub. Where we stand right now is we are in the 3rd leg of this repair. The first leg was accomplished a couple weeks back. We found a faulty wiring issue behind the wall, which was causing the breaker to trip. That was fixed. Second thing was there's an air circulating pump, which is the main feed for the bubbles in the jets, and that pump was also replaced. Lastly is when you press that little silver button on the wall, that actually goes to a controller. The controller is being replaced as well. So I don't have an estimated repair time. That's the last thing out of the 3. Mainline pools is keeping me up to date, but we don't have a date that the controller will be on site. As soon as it is, it'll be replaced. Jets will be back up and running. The second update I have is for our 3rd water shutdown. This water shutdown will be on Wednesday, August 5th. Hopefully, we're going to run this from 8 a.m. to 2 p.m. with the hope and expectation that we can finish it earlier. We have been finishing them earlier, so I'm hoping that we'll do the same. This is the last water shutdown for that side of the complex. This one's going to take place in Danzig, but it will affect Aladar, Kelso, Danzig, Saratoga, and Woodland. So the one side of the community will be without water for those times, but the commons, the healthcare center, Ascot and Belmont will remain, and the gardens will remain waterful. Yeah. I do apologize. What was the third update?
Yeah, once you
sorry.
start making up words, it's what?
Yeah.
Where do we go from there?
Waterful.
We're gonna have to make our own dictionary.
Yeah,
Waterful.
It sounds good.
That's wonderful. I mean, it's just. The third was to make sure that everyone.
I know what the third one was.
Yeah,
I know what it was.
Yeah.
Yep. It's very bittersweet for me to announce it again, but Debbie Capuzzi, the Housekeeping Environmental Services Administrative Assistant, will be retiring, and her last day will be on August 14th. And Debbie brings 15 years of experience with Whitehorse, and she's just been a phenomenal asset to both myself and the community, most of all the residents. So it's going to be very difficult to watch her proceed with her retirement, but I'm extremely excited. Over the year that I've been here, her and I would have many conversations about when she was going to retire, so she was really excited for this. She's been planning it. Her and her husband have been working hard to get to where they're at. They've now settled on their retirement home, and they're ready to execute retirement, which is very, very good. So that's great for Debbie.
And so we have an open house for her. I think it's tomorrow,
Yep,
right?
it
Ash?
is. Yep, it'll be tomorrow. Yep.
So, auditorium, 1 o'clock. Everyone doesn't have to come at 1 o'clock, but at 1 o'clock, we have an open house here for her. So let's celebrate her 15-year 15-year tenure. Yep.
That's it. So
That's it for you? Okay.
it is. Thank you so much.
Yep. Mary Small has a couple announcements as she's walking up here. Just want to remind people we have a marketing event this week on Thursday. We have something called a taste and tour. I think there's about 20 people coming for that taste and tour event. So there'll be, on Thursday, there'll be some extra cars out there in the parking lots from about 10:30 to 2 o'clock. So just be aware as those of you that are traveling up to the clubhouse, we'll have a little bit more vehicles parked around our clubhouse. How are you? Happy Monday.
Thank you. Happy Monday.
Good to see you.
Doing well, likewise.
Yeah,
Thank you. I wanted to let everyone know that we had a successful Cape May planning meeting last week. And there are a minimum of 10 confirmed people that will be doing the overnight trip. So very excited about that. That will be in September. I also want to announce that we have a very large dinner outing this Wednesday. Busload will be full. So that's very exciting. And some upcoming events that you have not yet seen advertisements for. So I'm going to announce them a little bit early. On Thursday, August 6th, we will have a trip to see the Odyssey. Many of you read that book. So that was actually one of the earliest dates that we could get. So we will be have a sign up out probably by noon today. So please sign up for that. And then on Thursday, August 13th, we have that trip coming up to historic Sugartown. Again, local, a very local historic place. So that'll be lovely. This Friday, don't forget, I did hear we have actually many musical talents in the audience. So this Friday, we have a matinee, and it's Broadway hits, but what it will be really is just a chance to watch some phenomenal performers and vocalists. So come to that if you're on campus. And the other thing that we have up and coming is we have a Stroud Preserve lecture. So that'll be in August. So super excited about that. Last but not least is the anniversary party. It's going to be lots of fun. It'll be campus-wide. Get your dancing shoes out of the closet, everybody, and come and celebrate. This is a wonderful place to live and work. That's it for me.
Great. Thank you, Mary. Excellent. Kim Goodall. Are we talking about person-centered care, Kim? Kim is our nursing home administrator. There are 10,000 nursing homes in the country. All nursing homes were born out of a hospital environment. In case you don't know, per the history books, back when William Penn was trying to get this original colony going, you think we have it hard. It was very difficult to get the colonies going. People were aging very quickly. And so William Penn, with the Quaker philosophy, congregate living, turned to one of the oldest institutions in, at that time, the colonies, which was Pennsylvania Hospital. Thank you, Nancy Hopko. You get a prize today. So Pennsylvania Hospital was one of the oldest institutions at that time. And so William Penn, as people were aging very quickly in their 30s and 40s, turned to the hospital and said, you know, we have this Quaker philosophy, congregate living, can you help us with caring for the aged? And so the hospital executive said, well, sure, let's create an almshouse like they have over there in Europe. And so they established some very early nursing homes in Society Hill. There was a couple of almshouses in Boston as well. But as you can hear, the roots of nursing homes were born out of a hospital. So when you step foot into 10,000 nursing homes across the country, if you just close your eyes and just, you know, magically appear and look around, they all look like hospitals because they were born from a hospital. And not only the environment, but the feel of it and the structure of it, the organizational design around it, and the institutional care around it. So, a little bit of backdrop. Whitehorse Village has an institution. We've had an institution for 37 years, our nursing home. And so Kim and Annie and the team, we are going to change that. We're going to change the institutional feel that we have here, both the environment, the look of it, and Kim's going to give us a little bit of a snapshot about what is person-centered care.
Thank you for that introduction. Actually,
Yes.
Michael summarized it very nicely. But we are very excited. We've formed a team to help with this initiative, and because it's going to be important for everyone to have feedback in terms of how this should look, starting with the residents, family members, staff members that are doing day-to-day care. So as Michael shared with you, there's actually a focus. It's well-intended, the care that's being provided, of course. And you have the regulations that have, you know, there's set expectations from the government. They say if you're going to receive federal funding, such as Medicare, then guess what? You have to follow these particular rules and guidelines. So the challenge is balancing all of those things, the wants and needs, the ability to get things accomplished within the regulatory guidelines. And so what we're doing is working creatively to bring all of that together to ensure that we have a nice home-like environment that starts with the actual needs and wants of the residents. So we got to work backwards because right now it's regulations. What do we need to do to make sure we're in compliance with the regulations? So flipping that all around. And regulations are not a bad thing. You know, I like to tell people, you know, they're written to ensure the, you know, the health and safety of the residents. And so, so nothing wrong with that. It's just the way we're interpreting the regulations that we really need to focus on changing. So, when we say person-centered care, well, what time do we like to get up? What time do we, prefer to shower? Do we prefer to shower 5-7 days a week as opposed to 1 or 2 days a week? As far as diet's concerns, what particular foods do I enjoy? And we're just trying to flip all of that around so that we're working differently. Does that make sense? I see heads nodding.
Yeah.
So, it's an exciting thing. And certainly, it's in its infancy stages right now because there's a lot of things that need to take place. And, we're talking when Michael talked about the history, we're talking about years of, decades of habits
institution and regulations and different forms and habits and behaviors that we have to break down and rebuild.
Yes.
You want to talk about the environment, the actual physical environment, how we're going to make this happen a little bit with the neighborhoods that we're
Yes,
building?
it certainly does. I think it's going to help tremendously with the transition. The renovations that Annie's speaking to is we're actually going to divide the health center, the Canterbury area, into 3 households. And each household is going to have its own individual team that will be self-managed because they'll be taking the direction from the residents. So they'll be planning their routines and around the needs of the residents, and then consulting with the administrative leadership team for any support and guidance that they need. So we're looking to do that after the kitchen renovations. So that will take place in probably March of 2027. And I think I'm not doing as much justice as Matt would probably do it if he were up here. It's nice to have a visual too. So I'll make sure that we have that planned just to show you in the future of how that will look and what the layout will be. But it's nice because each home will have its own entryway, its own living space, kitchen space. So it's hard to imagine that now for me, but Matt definitely has the vision and can speak more to that. So I'll definitely make sure that he's included in one of our updates.
Great.
Yeah.
So Kim and Annie are going to come up here, I don't know, every other week. We're going to talk about person-centered care because it's that important and it affects everyone. This is no reflection of the staff that we currently have. It's actually, as they've mentioned, we have been teaching institutional care for decades. It's what we knew, and now we're trying to, meaning the nursing home field, is trying to flip that whole thing around. And so we're joining a worldwide movement that's been around since the 90s, and we're going to flip that care model around, and it's going to be the hardest thing we've ever done in our entire careers. If you talk to the executives that have done it before, trying to flip a philosophy in the middle of complying with regulations that are for the most part institutional, it's very difficult. And so last week I heard somebody say at a board meeting, why does a resident only get 2 showers a week? Well, that's the institution talking. We have checklists for everything. And so we, now in a person-centered environment, if somebody wants to shower 7 days a week, they can shower 7 days a week. And so there's a lot that we need to talk about as a community, and we're going to be leading this effort. And it will be it's a journey. There is no destination with this person-centered environment. So you're going to see Annie and Kim up here talking often about our person-centered journey.
Right. And Kim is our chairperson of that steering committee. She does have a co-chair, Tina Becker, who formerly was our assistant director of nursing. She has a new job, and that is very comprehensively included in her new role. So, as well as myself and other team members are part of this. So that steering committee includes, as Kim said, residents, volunteers. It includes staff members, as well as
Our medical
our medical
director.
director and others. So it's very, very comprehensive. And so,
Wellness director,
yes,
actually.
yes, absolutely. Activities, yes. Sorry. Dale's comment was, is the person-centered care, that philosophy, the approach, and the neighborhood concept, is that intended just to be in Canterbury or other areas? So the response is it's intended to be a global approach, so all areas.
And then she also touched on the challenge too. Thank you, Dale. In that, we have a mixture of residents as far as needs. So we have some folks that are there long term with chronic illnesses that we're supporting. That's their home. So we'll have a designated area for those individuals. Then we have some that are coming through just for short-term rehab and returning to their homes. And so that will be a separate community. That's where our thought process is right now. And so the short-term rehab experience would be different from, someone who's there, that's their home. So a lot of things for the committee to think about and be aware of. So you're absolutely right, Dale. It is challenging. Thank you.
Very good. Thank you, Kim.
Thank you,
Appreciate
Kim.
Yep. Ryan Lang. There he is. Just want to talk a little bit about Four Seasons and personal care. Speaking of person-centered care.
Person-centered care. And we'll continue with flow of information. That was for you, Jeff. Sorry.
All right, good morning, everyone. So piggybacking a little bit off of Kim, because my team and myself are also working along with Kim with person-centered care. So over the next few weeks, I will be bringing data points here that we already capture and record to show you what we are doing from that standpoint with our residents. To give you some just rough ideas, we'll take dining up first as an example. So to the point you just heard, right, it's decades of that institution mentality. It's checklist-oriented, task-oriented. It's how a lot of CNAs are trained. That's just part of the program. So what we're doing is moving that further along into the person-centered care. So it's not just about capturing, did a resident eat, right? It's where they given the option to choose. So, and in my setting, like Four Seasons, where there are things like show plates, a resident in my setting may not be able to read and comprehend a menu. They may not be able to verbalize what they're looking for. So it's making sure they're seeing what those options are so they can still choose what they would prefer to have. As well as then things that are big on our end with cognitive impairment is contrasting colors. So they've done a lot of research. If you put things like mashed potatoes, cauliflower, fish on a white plate, residents may eat less because they may not notice it there. So it's using red is kind of the traditional color, but things like teal as well. So colors that pop, that the foods will contrast against, and it helps a resident then get more on intake, which is important. We still want that to be captured. But again, it's also making sure that when they chose that item they want, that then they are eating it as well. Same with nighttime routines. So what does a resident prefer to wear to bed? Is it pajamas? Is it just, basketball shorts and no t-shirt, right? It's what is their preference and making sure they have that available to them because that's what they prefer to wear. As well as what is it? Do they like to brush their teeth first in their nightly routine, or is that the last thing they like to do? So learning those pieces about them so that that activity is, again, centered around what their preferences are. So, like I said, over the next few weeks, I will be sharing all these data points that we already captured just to share with you what we're doing so you can see the care that's being provided over there from a person-centered care approach. Helps with transparency because I know there were some concerns raised last week at the board meeting It also helps, having the verified information. The compliance officer will be involved as well, so that there's another party involved just to verify all those data points. So again, want to be transparent with everyone so they see all the hard work that the team members are doing over there.
Is there a plan to involve the children of some of the residents?
So
Repeat the question.
So the question was, is there a plan to involve family of the residents? Great question, yes. So part of our admission process is filling out a history and social history form, so medical and social. So we have an idea of what a resident may have done for a living, their preference on waking up in the morning, what time they usually went to bed. Obviously, these things can change over time, but it gives us a starting point. Then also incorporating families into our neighborhood. So we do a monthly family night as it is now, and we're looking at expanding that as well to be able to incorporate more opportunities for the family to participate with our staff as well as their loved ones.
Excellent. All right. Thank you, Ryan. We appreciate you and your leadership.
Thank you all.
Yes, sir.
Thank you.
We have one update about the clinic.
Yeah, so just wanted to let everybody know that Dr. Christian and Dr. Jasani did start last week. So they're getting their sea legs. Again, water. Jeff left. Darn it. Anyway, they're getting their sea legs underway here. So if anybody's interested in doing a meet and greet, meeting them, learning more information about them, they are very open to doing that. We'll be inviting them to the community for open house day. We're just trying to coordinate their two schedules. They're both moms, so just trying to get that coordinated so we can get them here together so you can meet them. Tina is actively seeing people. I think to date she's seen about 12 people.
12 people, yep.
Yeah, so doing real well on that. So we're continuing to make sure you have services here on site if you would want to avail yourself of those. So,
Tina is the nurse practitioner
Tina
at the
Cosby.
outpatient clinic.
Tina Cosby is our nurse practitioner. So if anybody, again, is interested in meeting or seeing her, please let us know. As part of seeing any of these three individuals, whether Dr. Christian, Dr. Jasani, and or Tina Cosby, part of that is we do have to have you sign a couple of forms. So that would be a HIPAA release, a consent to treat, and then an acknowledgement for billing at the point, so that way the physicians can bill as well as Tina at some future point in time. So want to make sure we do that. I was going to give a very quick update on our Montessori training, and that's part of our culture journey, making sure our staff is trained on the techniques of Montessori. Montessori is a philosophy and an approach to how do we deal with somebody with dementia or dementia-related disorder. So it's very specific. So Candace Davis, Ryan in Personal Care Four Seasons, his clinical lead, is taking forefront, as well as Ethan in our wellness area. They've both been trained, and they are both certified instructors in not just one approach, but two different approaches of how to deal with and respond to somebody with dementia or dementia-related disorder. So our training is really going well, and we plan to have everybody in our healthcare center, which includes our Canterbury neighborhood, Bridalwood, and Four Seasons, trained by the end of August. So that we're clipping right along. And at that point, we're going to be doing some training with you as residents if you would like to be included in that. It's about a 2-hour comprehensive training. So we'll move forward with that. And then Reverend Addison wanted to share with you, if you see Reverend Addison, as you know, we're in a conflict again as a nation, and Reverend Addison is part of the team that receives our fallen soldiers in Dover. So she was called for a couple days last week to go and to receive the remains of our fallen soldiers. So please, if you see her, thank her for her service and providing that support to those soldiers and their families. So that's it for
Great.
updates.
Thank you, Annie.
You're welcome.
Appreciate you.
Absolutely. Appreciate all of you. Thank you.
Does anybody else back there have Colleen, do you have any updates for folks? Colleen has a couple of updates. As Colleen's coming up here for dining services, Ashley wanted me to remind everyone, actually not remind, just kind of make another announcement. Two things are going to happen in August. We have a new resident handbook coming out. I think we have a meeting today, kind of finalize some of the language in that handbook, and everyone will have access to this handbook at some point throughout the month of August. That was the first thing. And second thing, we're Ashley Bowden in administration's working hard with Crystal Weidler, our compliance officer, on implementing a resident engagement survey with a company called We Care Connect. That's the company's name, We Care Connect. And we have aspirations to roll this resident engagement survey out in August. So we're looking forward to that perpetual survey. How are you?
Great.
Great.
Good morning. So a couple of things. We have started a grab and go items in the cafe. They're located on the open air screen refrigerator where the beverages are, the bottom right-hand side. And today we started with a yogurt parfait. It's layered blueberry, vanilla yogurt, and granola. And then there's also a composed spinach salad with bacon. So if anyone needs something to quick grab and go, they will be in the refrigerator, and the menu will change every couple of days. So their team is working on all of that and the production list for that. Next is reservations for the anniversary party. Will begin this evening. And I'm just reminding everybody, with Dressage 1 and 2 turning into a kitchen, that we lose some seating space. So just have in mind that larger groups above 8 people will end up being a couple of tables to maximize our seating for the whole dining area. And also the menu is a surf and turf, which is lobster and filet. And if you have any dietary issues at your reservation time, you want to make sure that you note that. In other words, if you have a shellfish allergy, so we can make that a big filet or fix it for you. And that's really all I have.
Great. Thank you, Colleen. I don't see any questions coming in via email. Does anyone in the auditorium have any questions? There's two. So the question here is, there's 2 cars out front, outside the clubhouse. They kind of look like those, the housekeeping carts. They're both of those, and they happen to be the color black, and they sit right across from the harvester's garden. Those vehicles are for the sales team, as Tracy and Mary Jo tour people around every day. Instead of them getting in their own car to tour people around or walk around the campus, those 2 vehicles are for the sales team to drive them around the property.
Thank you.
Yeah.
One comment on the outstanding outpatient team that we've assembled, the 2 doctors, the nurse practitioner, and so forth. I talked to a number of residents who are holding back on making appointments because they feel that maybe they won't last, or let's try them out, or we want to hear from a friend who's already seen them. But I would encourage residents to support this team by making appointments for that cholesterol you haven't had checked in a year, the physical that you need that you haven't done in several years, and maybe that lump or bump that you're worried about, or rash or whatever. But we need to support these folks and make an appointment if it's warranted.
Great. Maddie up here is talking about the clinic, the nurse practitioner model that we have, and now we have 2 new physicians that are from Team Health, and she is hearing out and about that some residents are kind of waiting to hear how other people's experiences with the 2 physicians and the nurse practitioner, and she's just encouraging everyone to go see the clinic. Let's just not wait and go experience the services that they're offering now. We are confident with our 2 physicians and our nurse practitioner model that you will receive good primary care between those 2 different professionals in the clinic. So thank you for that. I appreciate that. Anyone else have any questions in here? Nope. All right. Hope you all have a good day and a better week, and we'll see you back here next Monday at 11 o'clock. Have a wonderful day.